Hi, everyone. My name is Joseph Greenwell. My pronouns are he, him, and his, and I serve as a Vice President for Student Affairs in University Life. And I'd like to welcome you to this first edition of Coffee Convos at Columbia. Today, we have a special guest that's going to be joining us to have a conversation about important information that students should know. So Dr. Melanie Bernitz is with us today. If you were here, we'd all be clapping. She is the Associate Vice President and Medical Director at Columbia Health. And she also serves as the Associate Clinical Professor of Medicine in the Center for Family and Community Medicine. And I just want to welcome you and give gratitude. Melanie, thank you for taking time out of your day to be here with us. And thank you.
Thank you, Joseph. Good to at least be sharing a cup of coffee or cup of tea with you this morning.
I know.
I'm glad to be here having this chat with you all. So thanks for joining us.
Thank you. Well, I know you don't like coffee, and so I'm having tea today because of that. So it's not quite English tea, but it is some nice herbal tea. So why don't we start really to get to know you a little bit. And so, we share a little bit about yourself, what you do at Columbia, anything you would like us to know.
Absolutely. Well, thank you. Well, I feel like I've been here forever. I came to Columbia back in 1999. So hit my 21st year here, spent a lot of my time up at the medical center, but I've been at the Morningside campus since 2016. And I've been in college health since 2003. So that really is a passion of mine. I'm a family physician by training, also have a master's in public health with a focus on healthcare administration. And so working in college health to me is actually the perfect conglomeration of all my skills, I would say. And being fortunate enough to have done this work at Columbia for so many years, I just feel very lucky to have that role here. I also have a life outside of Columbia sometimes with my family, my 3 kids, 3 teenagers in the house. So that's interesting, though the first just left for college. And, in free time, I try and enjoy time with family. I love to travel in the pre-COVID world and get around the country and the world. So looking forward to one day getting back to that. And I try and run. I'm slow. I'm methodical, but I get the distance in. So I've done 5 marathons, a whole bunch of half marathons. Yeah, but as I say, really slow, but I get the job done. So maybe that's my approach to how I work as well, right? Just slowly and methodically, and maybe that works, particularly in this situation we all find ourselves in right now. So that's a little bit about me. And yes, I'm a big fan of English breakfast tea. But the thing that goes with English breakfast tea is good English biscuits, which are cookies, chocolate-covered digestives, and then my other absolute passion in life is English milk chocolate.
Oh, well, that's good to know. Well,
Cadbury's all the way.
Put that out for maybe a birthday or something.
I'll never
as far
say
as
no.
being slow, I think it's all relative. I like to call myself a runner, panter, walker, and then repeat. And so
it all works.
That in short segments. So that's great.
Yeah, exactly.
So great. There's been a few questions. I like to call this segment quick questions, quick answers, as it were. And so there's, I think, 3 main questions that I've been hearing from students and in relation to COVID-19 and reopening that you might be able to support us in. And so the first one is really around the testing. I know that we have the gateway testing, but I think students are also wondering about ongoing testing for COVID-19. And I think some, have even showed up to gateway testing potentially for ongoing. And
right.
Can you talk a little bit about the resources and support for students?
Yeah. Definitely. It is confusing and it's all new for all of us. So gateway testing should be pretty easy. Everyone gets an initial gateway test when they first come back to campus. That's a one-off single test when you first get back to campus. And then your gateway testing is complete. Then we do have what I call the ongoing surveillance testing, and that's the way we're going to continuing to look at what's happening on our campus. And there's two different pathways for surveillance testing. One is for our undergraduate students who are living in congregate dormitory settings. And they have a frequent testing right now that is happening weekly, but that may change depending on the situation, both on campus and in New York City. For the remainder of our population, all our graduate students, our faculty, and our staff, the surveillance program is what we call random sampling. And we are taking a random sample every week of our population. The size of that sample will change based on what's happening, but right now it is at 5% of our population. And what we do each week is we send out an email to those who've been randomly selected to be part of that sample to come in the following week. We give a 5-day window, Monday through Friday of the following week, to come in and get a repeat test. So, and then each week a new random sample is selected. So some people may get selected multiple times over the course of the semester, but we do ask that if you get that email, you do come in for that sample test each week. That's allowing us to continue to look at what's happening on campus, and we will obviously adjust the size of that sample, potentially the frequency of that sample, as the campus situation and the New York City situation changes. What that means is we're not offering what I call voluntary testing. That means I just want a test. We can't offer that through the testing center at this time. We're happy to provide resources, particularly through New York City's Test and Trace program, where there are significant resources around the city for that voluntary type testing. And then the last bucket for testing is what I call symptomatic testing. I don't feel well, I have a sore throat, I have a cough, I have a fever. We ask that you don't come to the testing center if you're having any symptoms. Obviously, that's a high throughput testing center. If someone is symptomatic, we want them to be seen in a medical setting to get proper evaluation. So if you are a student who is symptomatic, please contact your campus health service, the Columbia Health at Morningside, CUIMC Student Health Services at the medical center. They'll give you a telehealth visit, usually initially, to evaluate you. And then if you do need a test, both of those facilities can arrange a COVID-19 diagnostic test as well. So the resources are available, but they're just happening in different places. So at the testing center, it's the gateway test and then the ongoing surveillance testing at this time. Obviously, if the situation changes, we'll notify our campus partners.
Great. That's really helpful. Thank you, Melanie. You mentioned contact tracing a little bit, and I think that's another question that people have. What is it exactly? What to expect? You know, where does the information go if you're sharing information? So can you talk a little bit about that?
Absolutely. So contact tracing is how we identify anyone who's been exposed to an individual who tests positive for COVID-19. So if we get notification of a positive test result for COVID-19, that person is the case. We interview the case, make sure they're okay, they have all the medical resources that they need, and then we ask them who they were in contact with during the period when they were infectious. And we have ways of determining what that period is. They provide us with the names of the contacts they had. We then reach out to those contacts to let them know they were exposed to an individual with COVID-19 and what precautions they need to take, which is usually a quarantine precaution. And we provide guidance on that. The contact tracing program that we have is a partnership between Columbia Health and the Mailman School of Public Health. And we do treat it as confidential and sensitive with the information. So when we identify a case, we don't disclose their identity to their contacts unless they want us to. So we just say you were exposed to an individual who tested positive, not the name of that individual. So we do treat the information really sensitively. The same is true for the schools. We don't notify the school of a person's name unless they want us to disclose their name. So the goal of contact tracing is really to prevent further spread. As you know, with COVID-19, people may be infected and have no symptoms. So by identifying close contacts of a case, we can quarantine people before the time then that they would potentially display symptoms or be infectious and prevent further spread around the community.
That's really helpful. And, you know, that clarifies a lot. And I think some of the concerns I've been hearing too from students regarding, what does that mean for me if I get contacted and what to do?
Yeah,
So
no, and we would really ask, we're trying to send secure messages saying, hey, you're going to get a call, so it doesn't come as a complete surprise. And we would ask that you answer that call and provide as much information as you're able to provide, just knowing that we do treat your data so sensitively. It's housed within the medical record, so it has the same protections as other data that you share with us in those conditions.
great. Well, my last question is really a broad question. Given your expertise, what you know, your long history at Columbia, even, which is great. Over 2 decades of Columbia experience and support, and thank you for everything you've done. What would you want students to know at this moment in time as we're reopening with COVID-19? What is important that you think that students should be aware of?
That's such a great question. I think it's really thinking about how we continue to protect ourselves and protect each other. We're spending a lot of time thinking about testing or contact tracing, and those are just a couple of elements in a bigger picture, because what are the things that really work here? And I know I've said this in so many other forums and formats, but it is those basic measures, that physical distancing, the wearing of the mask, the hand hygiene, the staying home when you're sick. Those are the things that really, really prevent spread of this infection. And of course, getting your flu shot when we have flu shots available starting September 14th, because we want to minimize the impact of flu as we go through this season. So really thinking through the decisions we all make, how we interact with each other, how we interact as a community, because as we make these choices and we take care of ourselves, we're actually taking care of the broader community at the same time. So it's just remembering all of those pieces that allow us to get to this very strange new normal that we're all living in. We know it's not ideal. We know that sometimes it's not as fun as we would want it to be, but it does allow us to get our campus back to a vibrant learning community experience, and allow us to continue to be together even while we've had to make some changes to the way we interact.
Yeah, that's so important. I've started actually a daily practice, the attestation app clearly, but I have a thermometer. I just check I check it every day, and
right.
It's really more about I actually check it every day. I'm going outside my apartment or going to campus clearly with attestation, but even if I'm not going to campus on the weekend, I check it to make sure that I have a temperature, and because if I do, I will stay home. And just trying to be mindful and wearing,
Perfect.
I also bought about 20 different face coverings. You can get them relatively cheap.
Yes.
And I have one in every color. So
absolutely. You can match them to your bow tie.
Right? I'm trying.
Absolutely. It becomes the new fashion accessory for sure.
I'll probably wear them post-COVID. I don't know. Come through season and other things. So we'll see how that goes. So I so appreciate your time, Melanie. And again, such gratitude. You're not only being a leader with Columbia Health, but really being a leader across the campus on this, the university response to COVID-19 and the thoughtful care you've put into this and support. And I know you yourself, respond to emails to people and all their questions and support and students, and have really made yourself available. And so, just extreme gratitude, for everything you're doing and taking this moment in time to do this quick interview. So thank you.
No problem. I'll tell you that one of the many silver linings of this crazy experience that we're all going through, I realize how proud I am to be part of Columbia, because seeing how everyone has stepped up and how our entire community has just worked together to make the best of this and to get us to where we are now makes me really proud to be part of Columbia. So I hope as students are coming back and experiencing, our new Columbia, we all feel the same pride in our institution. So thank you for having me on today.
Of course. And this is our first one. So you are our first guest. This is meant to have more, everyone who's watching this. If anyone's watching, hopefully people are watching this. And so please email us at universitylife.columbia.edu if there are particular questions or particular individuals you think it'd be helpful to hear from, regarding student issues and how we can bring more information to you in different ways. So again, big gratitude to you, Melanie, and thank you for being our first and all the work that you're doing. And, and gratitude to everyone in the campus community. And I really, it's not just about working together, but also taking care of each other, right? We're all taking care of each other and being thoughtful and kind of helping each other to uphold the compact, wear face coverings and physically distance, and to connect, right? And to continue to have a vibrant, healthy social community, but responsibly. So a big thank you to everyone. Until next time, we'll see you soon.
Bye.